If you've ever seen bright red blood in the toilet or in the toilet paper after a bowel movement, your heart probably skipped a beat. Today we're going to talk about something sends thousands of people to the doctor every year. Bright red blood in your stool. We'll cover what causes it, when you should be concerned, and most importantly, when you need to see a doctor. Hi everyone, I'm Dr. Peter Aziz. I'm a board-certified urogynecologist and pelvic surgeon. Today we will be talking about bloody stool. So seeing blood where it shouldn't be is alarming. And here's what you need to know right away. Bright red blood in your stool is not always a medical emergency, and in many cases it's caused by something relatively minor and treatable. However, it can also be a sign for a more serious condition that needs immediate attention. By the end of this video, you'll understand the difference between common, less serious causes and warning signs that require urgent medical care. This information could literally save your life or the life of someone you love, so let's dive in. So what does the color tell us? Before we discuss specific causes, it is important to understand what the color of blood in your stool actually means. So bright red blood typically indicates that the bleeding is coming from the lower part of basically the rectum, the anus, the lower portion of your colon as well. The bright red indicates that the blood hasn't been digested yet. It's relatively fresh and it hasn't traveled through that entire length of the digestive system. This is very different from dark or black stool, which indicate that the bleeding is higher up in your digestive tract, like your stomach or your small intestine, and the blood has been broken down and partially digested. This is why it appears darker. So when we're talking about bright red blood today, we're focusing on bleeding from the lower part of your colon, rectum, and anus. So what are some of the common causes of bright red blood in the stool? I'm going to start with things that are less serious and more common, and then we're going to move toward the ones that are concerning. So first, hemorrhoids. They are the most common cause of bright red blood in the stool. These are basically swollen blood vessels in and around your anus and the rectum. They can be internal, inside, or external around the anal opening. When you strain during a bowel movement or you have hard stools, the hemorrhoids can bleed, and the blood is usually bright red. You might see it on the toilet paper as well. You might see it in the toilet bowl. It can be coating your stool. They are extremely common, affecting about half of all adults by the age of 50. Other symptoms can be itching or pain, or a lump near your anus. The good news is it's generally treatable with lifestyle changes, some over-the-counter medication, sometimes minor procedures, and it's not dangerous at all. Second thing is anal fissure. A fissure is a small tear in the thin, moist layer that lines the anus. These tears usually happen when you try to pass also like hard, large stool. Think about it as a paper cut, but in a sensitive area. Again, the blood is typically bright red and appears in the toilet paper or on the surface of the stool. The main symptom is sharp, sometimes severe pain during and after a bowel movement. You might also experience spasms around the little ring of muscle around your anus. Most of the time they heal on their own, again, not dangerous. Some treatments for this include stool softeners, fiber, hydration. All of those things can help. So let's talk about some other colon issues like diverticulitis or diverticulosis. This occurs when there are small pouches or pockets. They form in an area that is weak in your colon. Extremely common as we age, especially after 40. These pouches can bleed when the little blood vessels rupture, and this is called a diverticular bleed. You might see bright red or maroon colored blood in your stool. Bleeding can be significant, can be a little bit, and it's usually painless. However, if these little pockets, they become infected, it can cause diverticulitis. That can cause fever, pain, changes in bowel habits. Another condition regarding your bowel is IBD or inflammatory bowel disease, something like Crohn's disease or ulcerative colitis. I'm sure a lot of people heard about that. They are chronic conditions where your immune system started attacking your own digestive tract, causing inflammation. The blood in the stool is a common symptom of IBD. You can also have cramping, diarrhea, weight loss, urgency to poop. Blood most of the time is bright red, especially with ulcerative colitis, because it affects the colon and the rectum. IBD requires ongoing medical management and monitoring, either by a gastroenterologist or a colorectal surgeon. Colorectal polyps, also another condition that can cause bright red bleeding. So polyps are just a little bit of a growth on the inside of the colon or the rectum. Most of the time they're benign, meaning that they're not cancerous. Sometimes they can develop into cancer over time. They can bleed, however, most of them, you don't even have any symptoms. This is why a screening colonoscopy is very important, because they diagnose these polyps and they can be removed during a colonoscopy, which can help prevent colorectal cancer. So this is the next topic we're going to talk about right now, is cancer, colorectal cancer. While it's not the most common cause of rectal bleeding, it is the most serious, and it's why you should never ignore blood in the stool. Colorectal cancer can cause bright red blood in the stool, especially if the tumor is located lower in the colon or in the rectum. Other symptoms can include changes in your bowel habits, unexplained weight loss, weakness, fatigue, pain. The American Cancer Society recommends that adults at an average risk begin regular screening at the age of 45. However, if you have family history or inflammatory bowel disease, you may need to start screening early, because early detection dramatically improves the outcomes, because it's a highly treatable condition when caught early. There are some other less common causes of bright red blood in the stool, like infections, for example, bacteria, parasites. They often come with diarrhea, fever, cramping. If you've had some sort of radiation because of cancer, radiation to the pelvis, that can cause damage to the lining of the rectum and bowel. It can cause colitis or inflammation. That can cause blood flow to part of your colon to be reduced. Certain medications like blood thinners can increase the risk of bleeding throughout your body, including your digestive tract. So here's the most important part of the video: when to see a doctor. Some situations require immediate medical attention and you should not wait. So, emergency medical care if you experience any of the following. If you have a lot of blood in the stool that would not stop. If you have severe abdominal pain or cramping with the bleeding. If you feel dizzy, lightheaded, you feel like you might faint. All of those signs meaning that you're losing a lot of blood, like you're having rapid heart rate, shortness of breath. You gotta go to the ER right away. If you're having black stool, in addition to bright red stool, might indicate that you're bleeding from multiple sides. If you're vomiting blood, also a very serious issue. All of these symptoms indicate serious medical emergency, and you have to go to the ER right away. So if you don't have any of the signs that we just discussed, that means it's not urgent, and you can schedule a visit with your primary care or a gastroenterologist soon. I mean, don't delay it too much. If you're seeing blood, for the first time, even if it's just a small amount, bleeding recurs or persists over multiple bowel movements. If you're over the age of 40 to 45, haven't had a recent colonoscopy, changes in bowel habits, unexplained weight loss, abdominal discomfort, bloating, or if you have a family history of cancer, make an appointment with your doctor to have a proper evaluation and screening. So my final thoughts would be bright red blood is always worth investigating. Do not ignore it. While it's often caused by something relatively minor like hemorrhoids or an anal fissure, it can also be a sign of something more serious, including colorectal cancer. So never ignore it. Don't be embarrassed to talk to your doctor about it. We see these things every single day and we are here to help. So if you found this video helpful, please give it a thumbs up, subscribe to my channel for more evidence-based medical information about pelvic health, general health and wellness, about urology. Leave your questions in the comments below. I'll do my best to answer them. Thanks for watching. I'll see you in the next video. I'm Dr. Peter Aziz.